Hi, everyone. I do want to make everyone aware that the session is being recorded. If you do not consent to being recorded, you're asked to drop off the session at this time. I'll wait a few seconds to see if anyone wants to drop off. All right. I see a bunch of familiar names in here, but I'll go again. My name is Darby Gallagher, and I am a project coordinator with the National Indian Health Board. And I will be moderating this breakout session of the Don't Miss Your Shot COVID-19 Youth Summit. This is the early career session, how to talk about the COVID-19 vaccine and how to address vaccine misinformation. And our presenter today is Cassie Jones. I'm so excited, you guys are gonna love her. Before we get started with today's presentation, I have just a couple of housekeeping notes I wanna go through. As you know, the session is being recorded and it will be posted on the NIHB YouTube page, I would say probably like next week. I have also enabled the live transcript for the meeting today. If you wish to hide that live transcript, you can click the live transcript button and then hide subtitle. And as I'm sure you all know, you have all been muted. Please leave yourself on mute unless the presenter specifically asks you to unmute and engage. And if you have any questions, please use the chat feature. And we will try and keep most questions to the end. And then I'll read questions aloud for Cassie to answer during the Q&A as time permits. And if you have any technical questions, please reach out directly to me or to Courtney via chat, and we will be able to help you out. All right, Cassie, I will turn it over to you to introduce yourself, and then we can get started.
Okay, thank you so much, Darby. So I'm going to go ahead and pull up my little slide deck, and hopefully, it's been a while since I presented. Great, okay. So a little bit about myself as we get started. My background, and I'll make this brief, my background ranges in a couple different areas because I wanted to have this intersectional lens when it came to public health. So I started off wanting to pursue a career in the medical field, got a BS from University of Laverne in California in kinesiology, had a really strong calling to think about nutrition careers, and then ended up at NYU for their global public health programs. So while I was there, same thing, I wanted to take as many courses as I could in an array of different topics, from mental health to nutrition to environmental health. I actually ended up getting an advanced certificate from NYU. And then during the pandemic, decided to get a master's in business from the Quantic School of Business and Technology. While I was also getting this degree, I started my professional career after I graduated NYU in 2019. And throughout my academic career, I also started to identify that there was a lot of gaps between academia and communicating with the general public, educating and empowering communities, as well as translating research and journal articles into more digestible materials. So I started working with organizations and nonprofits such as the United Nations, THEA, or Texas Health and Environmental Alliance, another nutritional nonprofit called Kitchen Connection, and then most recently, the Urban Indigenous Collective, just to name a few. While this was all going on, I was working on small side projects for videography, digital campaigns, and social media management for these organizations. I was also hired on with a health insurance company to work in their communications department. And so now I experienced an array of different digital media campaigns, built a lot of hard and soft skills within communications, and have a ton of experience working with different groups. So the very, very basics of creating a culturally competent digital campaign, first and foremost, the way that I walk through this, either with a nonprofit or an organization, is by looking at the target audience. So who exactly are we speaking to? What is the age range? What's the demographic? And what kind of messaging are we trying to deliver to this group of individuals, right? Typically I've found, and the industry standard has been to try to avoid the use of jargon. As we've probably all experienced now at this point within the pandemic, you saw so many different terms being thrown out on the media or in the media that most people have never heard of in their lives, let alone could put two and two together and decipher the messaging that news outlets were trying to communicate with people. And while we were trying to make it evidence-based, we also have to understand that creating a digital campaign, especially within the healthcare field, we need to make it at like a 5th and 6th grade reading level so that it's more inclusive of all education levels, and not being assumptive that people have had a background in the scientific field. So another thing to keep in mind that for any type of health campaign is where we're getting our research information and sources from before even trying to address the spread of misinformation. So creating these building blocks are really important. So before any content is created, before any campaigns are laid out, understanding, if you're speaking to everyone, you're speaking to no one, and your message should be very clear and concise. So what I've experienced with Urban Indigenous Collective, what I've experienced with some of these other nonprofits, as well as the health insurance company I worked for when we were looking at a vaccine hesitancy campaign, was walking through these building blocks is first, we need to definitely define these medical terms, define the public health terms, break down some of these more complicated concepts of how does the science work, right? How does the biology work within our bodies? How do vaccines get created? And breaking down each of these concepts into more bite-sized, digestible pieces of content for everybody to understand, because we don't know, right, with the internet, who's viewing this, and it could be a teenager on the West Coast, it could be someone who's over 65 plus, someone that has medical background or hasn't. So creating these foundational building blocks first, then of course addressing the historical context of why certain demographics might be hesitant to have any type of vaccine, where the medical mistrust is coming from, why there is hesitancy to begin with, addressing some of the misinformation by proving fact to fiction and debunking some of these myths that had surfaced during the pandemic surrounding all vaccines. Then going another layer higher and higher, right? So addressing the specific areas of concern by collecting qualitative data. If we see in comments, if we see in forms and surveys and in the feedback that there tends to be, or in town halls, is that there tends to be specific areas of concern, specific questions and comments constantly coming up, compiling that to then address it later on. So after all this was conducted first, right, these building blocks of a digital campaign that's addressing vaccine hesitancy, only then did we start to inform the public on where they could get vaccinated, and from trusted partners, from trusted places, why they should get vaccinated, and then also what changed for others, and convince them to get vaccinated after they had gotten all the facts, all the information to make an empowered decision, and that was right for them and their family. Another thing that I really want to emphasize in building these types of campaigns is, in this day and age, authenticity is the new golden rule. Sorry, getting tongue-tied. When you think of social media, when you think of content that you consume on a daily basis, who are you more likely to trust? A celebrity or your best friend, a mentor or a politician? So within both campaigns that I worked on earlier this year, we tried to identify specific community leaders, trusted individuals within these spaces that could speak volumes on why people should get vaccinated, and and the medicine behind it. So we didn't try to necessarily avoid talking about the negative sides of vaccines, the concerns that people might have had, but bringing in people that could gently handle the negative sides to vaccinations or possible areas of concerns, physicians, to allow people to, again, have all the information they need to make an empowered decision. Combating misinformation, essentially, it just takes patience, because you have to have this continuity in language and messaging to create an emotional connection, to create trust. So having, I've seen pros and cons to marketing campaigns, and one example I'll touch upon more later, but essentially corporations tried to come in, build out and spend all this money on campaigns for vaccine hesitancy, and they were speaking to no one. They didn't bring in trusted individuals. They brought in random people to try to advocate for getting vaccinated. And the reason why it takes patience is, belief systems are strong. You could give everyone all the information, you could provide them with all the facts that they need to make an empowered decision, and it could still not be good enough. The way that people consume information at the present time is still through social media, Facebook and certain websites. So the purpose of having these types of campaigns is to combat, right? By having consistent messaging, by creating trust within a company or an organization's brand. And as we saw with some of this qualitative data that came out about the media regarding vaccine hesitancy, regarding the COVID cases as in itself, the United States media was fear-mongering at a rate that was, like 10 to 15 times higher than any other country. And we saw what fear can do to people. It creates a much stronger emotional response than facts would. So I wanted to bring up some examples of a vaccine hesitancy campaign that I worked on with Urban Indigenous Collective. So again, this, going back to what I mentioned earlier, broke down, everything that people would need to know, historical mistrust of vaccines, especially in Indigenous communities. And these are just samples, but the campaign did build off those building blocks I mentioned earlier. And then the picture on the right was trusted members of the community that were brought in to have conversations. Later on in the campaign, after all these graphics and conversations were had, then we asked specific members of the organization to share what changed for them. When did they decide to get vaccinated and why? Some of the things that came up at that time were then advocating for, I'm getting vaccinated for my family, I'm getting vaccinated for my partner, I did the research, I found reputable sources online. And then I also wanted to show in comparison, not that there's anything wrong, but this was a campaign that I worked on internally with the health insurance company Health First. So this information never actually made it public, although they have millions of clients and patients and huge followings. It was really disappointing to see, some of this information just never surfacing. And instead, the chosen campaign that they used was stock footage of people and a voice that, you never saw the speaker's voice or the speaker's face, who was the voiceover on the video. And they spent so much money behind that campaign to really promote it across so many platforms, and yet it flopped. So that being said, it's not to say that this type of information wasn't useful. This was just for an internal campaign with addressing vaccine hesitancy in employees. But it was a visual example of some of the types of content that UIC had made. It was also based off of this. Even though it never got shared, I still think that breaking things down in a way for people to visually see what is in vaccinations, how are they tested, how are they approved, and then having these conversations made a huge difference in providing people with the information that they needed. So I'm happy to answer any questions, expand upon some of these campaigns, or talk about any challenges that I might have faced in the last like 11 months, 10 months, year now.
Thank you so much for that, Cassie. That was great. And I forgot about a lot of those that we did. I can go ahead and start with a question and kind of try and get the ball rolling on this conversation. So what have you found to be the most challenging thing about combating COVID misinformation on social media throughout like, all of the work you've done?
I would say most definitely is people pulling their information from non-reputable sources. So someone somewhere tries to create a false or fabricated website or organization, and then spread that information around being seemingly like a reputable source. So I think that's part of the reason why it catches like wildfire. And then also I would say having trusted leaders within any community in any space advocating to be anti-vax or just anti-COVID vaccine. So not realizing the power and influence that their words have, especially if they're like a A-list celebrity or a high-level politician. And I think it caused a lot of damage. The other thing that was really difficult and still is to this day is not having collaboration between nonprofits and larger organizations. The CDC, WHO, and then state health departments, they were not communicating with each other. And so we had the trusted sources almost giving out competing information. Even the FDA, like we're talking about boosters now, and the FDA and CDC are at odds with each other yet again about what is the actual recommendation. And something I just saw recently on the news was now we're having state governments essentially ignore the CDC guidelines and go ahead with approvals on boosters anyway. And the CDC is now playing catch up. So it makes it really difficult that we don't have more collaboration in these spaces and communication. So I think that would definitely be one of the biggest challenges.
Yeah, that's a good point. Because I know in New York, they just okayed everyone to get a booster, right? And
either they just did or they're about to. Yeah, I haven't heard about that quite yet, but yeah, definitely.
I can go ahead and ask another one. I know you like briefly touched on it just a little bit, but what sort of challenges have you faced being like so early on in your career, especially now like during this pandemic?
I was not prepared at all post-grad for a pandemic. When you decide to go into public health, you kind of have a vision in mind for like something you want to do, some area and topic of focus that you want to address and make a difference in. And then to have all of those hopes, dreams just be put on hold because the world is in crisis. I was not prepared for that, but at the same time, it's now created opportunities for so many people, whether it's small businesses and shifting the economy, or providing people with the time to take a step back and really think strategically about partnerships, about ways of communicating in different spaces and how we can come together to create better messaging. So I'm as difficult as this was to get through, I know that we are getting through it. And I just hope we come out on the other side with more resources, more access, or reducing barriers to access to allow for people to address all the other public health issues that are still happening.
I agree. I know like I had the hardest time, especially like because I graduated in May with my MP.
The middle of it.
Right. So I like had half a semester in person, and then like the last semester and a half of my MPH I was online, and
yeah,
trying to find an internship and then finding a job. It was
yeah. Well, that's the nice thing about, I guess, the area that I've gone into. So the program itself did not necessarily have public health communications, which as a minor, as a class even, which I found very strange because all the academic work that's being done, all the, programs that are being created, all the nonprofits that are out there, there's a lot of really great work. And yet we don't have the word being spread about it. We don't have the word being, we're not able to get the word out on what everyone's doing. And so that's kind of the area, the gap that I think I would like to address. And I hope with this now digital age, we're able to start prioritizing the communication style so that maybe nonprofits get more funding, maybe the resources start to be allocated appropriately. I mean, we've seen the power of social media for good, right? And how it can cause movements and change, like social change. So I know that it's a powerful tool. I wish it was incorporated a bit more into just any level of education and how to really leverage it.
Yeah, for sure. So this is a question in the chat from Joseph. He asks, what technique of communication helps tweak or dissect out misinformation from an overlying political perspective? And then is it possible to be successful to persuade someone to get vaccinated?
Okay, so I'm going to start with the second question first. So yeah, it was definitely possible to persuade someone to get vaccinated. I've had a couple of personal friends who were waiting for a reason. They didn't have all the information that they needed to feel comfortable and confident to go and get vaccinated. So some people were waiting until it had FDA clearance. Some people just needed more factual information, especially if you're, immunocompromised or have the possibility of allergic reaction. Those are all genuine areas of concern, right? So it might have taken them a little bit longer, but having the conversations in a compassionate and efficient way made a huge difference. I know just allowing for people to ask questions, allowing for people to state their opinion, state their reasoning why, and just providing that safe space to explore really changed the tide for even in my personal life, several people. So I can only imagine that continuing to develop these campaigns going forward is going to be really crucial for a lot of public health solutions. So then the other question was, what technique of communication helps to tweak or dissect out misinformation from a political perspective? So I would ask if you could maybe clarify the political perspective or just the question a little bit more, if you don't mind, but I can address the first part of that, definitely. So dissecting out misinformation and combating it is, again, right, having continuity in your sources, having continuity in the language and the messaging. So the more you try to branch out and try to catch all this misinformation, like it's a never-ending game. But if you remain consistent in your messaging as an organization or as an individual, chances are, right, the more people who are talking about the same information and remain consistent, you're not going to be as likely to believe information. If you're asking, well, where did you get this stat from? Where did you get this article from? And then having the conversation about trusted resources, right? And what one person trusts is not always going to be the same as another. I guess from a political perspective, it's difficult when you have leaders, again, right, also citing these other websites and leveraging misinformation for their own political agenda. There's nothing that I can really say that we can do about that. But again, right, there's also other politicians that know that we should be using trusted resources. And so continuing to amplify those messages is what I found probably one of the best ways to combat it. No worries. It was a good question and made me think a little bit too. I appreciate it.
Yes,
Um,
adding your questions to the chat. I can ask you another one if you want, or we can wait. So this one is a little, it's, I don't know, it's kind of like broad, I guess. What advice do you have for other early public health professionals who are just starting out? Like, what have you learned that's worked? What hasn't worked? What could you change if you could change one thing, like that sort of thing?
oh, totally. So I struggled to find a paid position for about 8 months, and I did everything right. Like I went to all the seminars and workshops and applied and did everything that my university was telling me. But I actually, thankfully, my partner now is a recruiter, and so he taught me all about LinkedIn and how to leverage LinkedIn as a business tool, as well as a professional development tool. So it instantly changed the job search for me. So what the best piece of advice that I have is leverage LinkedIn, grow your network. I literally went for about 3 days straight and just looked up all the directors of communications for any type of group that I could possibly see myself working with, and hit connect, just connect for hundreds of agencies all across the US and international as well. It took some time, right, for people to check their LinkedIn to approve the connection. And then once they did, I sent a personalized message. I mean, it was a little copy and paste, but personal to each individual, thanking them for the connection and just letting them know, like, do you have time for an informational opportunity, or I'm sorry, informational interview? Like, I'm looking for new opportunities. Would love to hear from you. So short, sweet message. And I kid you not, within 12 hours of doing this for like maybe 50 people, I got over a dozen responses, everything from send me your resume, here's my personal email address. So you're now skipping the queue in whatever, algorithm is checking your resume and your application on LinkedIn or Indeed or all these job hubs. Like, you just get lost. But having a personal connection by leveraging the social media platforms made a huge difference. And I got a couple of interviews within the week, and it had been silent, like no, heard nothing. So that's my best piece of advice: is leverage LinkedIn, build your network, and don't be afraid to connect and reach out, because you honestly never know, like, timing could be just right and they might have an open opportunity coming your way.
Yeah, thank you for that. That's a good idea. Not that I'm like actively looking for a job or anything, but it's still very
No,
good information. So let's just say, like, I know for you it was not the case, but like, let's say while you were going, like even before you got to grad school, but like you knew that you wanted to get into public health, how would you like go about talking about COVID to someone who's like, hey man, where are your credentials? What kind of like credentials do you have? Why are you like talking to me about this? Does that make any sense?
Oh, okay. So if someone came up to me on the street and was like,
Like,
I want to talk about COVID and what makes you an expert, kind of thing.
yeah, like how would you go about that conversation just with like a random person on the street, like who doesn't know who you are? Not that it would like ever happen, but
Yeah, no, I mean, so a little bit of further background information about me is that I am a daughter to two teachers. So I always tell people that I'm meeting for the first time, job interviews, informational interviews, and networking, that I'm committed to lifelong learning. When you choose to stop learning, you stop growing. So it's going to be a constant cycle of learning and unlearning, because the education system changes and evolves and then regresses. And so, depending on where you live, where you were brought up, your education might be completely different to that of someone else. But we have the internet and we have an unlimited supply of resources to continue to learn. So if someone came up to me on the street, I would mention first and foremost, I do have these credentials. I went to school for public health. I studied this, I practiced, I've now had a couple of years of experience under my belt, but by no means would I consider myself an expert on the subject, because health constantly evolves, science evolves, and what I know right now and the research that I've done right now, it's going to change in 5 to 10 years. So from everything that I've gathered, I consider myself to be someone that is educated on the subject, but by no means like an expert. So I'm open to hearing what people have to say and walking through why they have those concerns. So if someone came up to me, I would just let them know, like, hey, I did go to school for this, but that doesn't invalidate your opinions and your fears.
Thank you for that. I have one more, but audience members, if you do have any questions, feel free to raise your hand or unmute yourself, or type them in the chat box. So what kind of, since I know you, like we did a COVID campaign together, what kind of tips do you have just from your experience doing that on creating a campaign, whether it be like on COVID vaccines, or just on like another infectious disease in the future?
So I would say, first and foremost, when creating a campaign like this, be very strategic in your messaging, and figure out what your goal is. Your goal is never going to be to change people's minds, because that's not possible. You're fighting an uphill battle. But be very clear on the messaging. Like, are you trying to get people, to donate to your organization, to go to a certain site and get, get a flu shot, get vaccinated? Are you trying to get people, like, what are you trying to get people to do? And if it's just informational, right? If you're just like, I just want to educate the public, that's also still a strategic goal. When it comes to the types of content, I would say that we've seen now in the past couple of months that video is being prioritized, and it's going to be the way of the future. So having a content mix is great. Like, we had a lot of graphics, and we tried to create shareable content, or content that was valuable and resonates with someone. However, I would say that the type of content makes a huge difference. So I would personally prioritize creating a video campaign, having like a series of videos, whether they're explainer videos, live streams, and like Instagram, Facebook lives, or short and bite-sized pieces of content. So instead of maybe like a graphic that people have to swipe through and read and it takes time, doing the same thing, but having it be like a 5 to 7 second video that very quickly breaks down one concept. So that's just what I could see if I could like do the vaccine hesitancy campaign all over again, what I would definitely want to do and how I would want to shift it.
And then like, just kind of piggybacking off of that, what, like, based on your own experience, what have you found, like, which social media site kind of gets the most engagements with the COVID project? Was it Instagram? Was it Facebook? We tried for TikTok.
Yeah, so that's very quickly evolving as well. And honestly, it takes my breath away a little bit sometimes with like getting whiplash on how many changes are happening within social media at the present time. I do know that like consistency is key, and you're going to capture different target audiences depending on which platform you're using. So, I would say one, it depends on the organization. How big is your organization? What platforms are you currently on? I think people underestimate the power of LinkedIn because they have what's called infinite virality, meaning like your videos, your blog posts, and information will continue to get pushed out further and further and further to more connections. It doesn't have, at the moment, it doesn't have the same algorithm that Facebook and Instagram do, which is like, we only want the most buzzworthy, newest content. LinkedIn is a little bit different. So I would say, prioritizing the platform based off of the target audience that you're using. Facebook tends to be a bit more geared towards like the older generations, whereas now Instagram is becoming like a millennial thing and kind of like age 20 to 40, I guess. And then, TikTok's definitely geared towards the younger generation. So I think the most important thing is not necessarily like, where should we be? If you can and have the budget, have the time to post and repost content across all platforms, it's more about like tweaking the content, tweaking the campaign to use different language that is geared towards that target audience. So on TikTok, maybe a bit more lighthearted and a bit quicker, right? On Facebook, maybe a bit slower and more detailed. So that would be my best piece of advice for that.
Thank you for that. And then I just have like one last question. I'm
Okay.
trying to figure out like how I want to word it in a way that's like gonna make sense when I say it out loud. So it might take like one or two tries.
That's
But
okay.
like when you were creating like all of the campaigns you were working on, which sort of softwares did you use? Like, was it Canva? Was it Visme? Was it something else? Was it like through the Instagram stories page? Like, what kind of software did you use and which one did you like the most and why?
Yeah, of course. I personally, and this is what I've carried on with using, I personally love the Adobe Creative Suite. So that's everything. You don't necessarily need to purchase the monthly subscription to use all their software. You could always just buy one piece of software. And they have free versions too. Like Adobe Rush is a video editing platform that's free, and it links across multiple devices. So you could start editing on your laptop, finish editing on your phone, post to social. So for higher level video editing, I do use Adobe Premiere. Both of those video editing platforms are just so much better than iMovie. And once I got into like professional video editing, I prefer them with the flexibility that they have to quickly resize videos from, like a landscape Facebook video aspect ratio to a TikTok aspect ratio. So love those for video editing. And then Canva has become very, very quickly this all-in-one tool. Now they even have video editing capabilities, which it's still very like in their kind of like beta testing round and not very extensive. But I remember when Canva was just very, very limited and you could make like a cool flyer or maybe a couple things. And now it's just become this all-in-one tool. They have Photoshop capabilities, they have video editing capabilities, graphic design capabilities. And the nice thing is when I was using it with my corporate company, we looked at the legalities behind using the software. So, are we going to get fined or sued, or is there going to be any legal issues from using this? And there pretty much aren't any, except for, if you take someone's designs and then try to sell them as your own, that's pretty much the only thing that they care about. But they compensate their creators when the graphic designers and videographers upload stock footage and stuff to their platform. The creator gets compensated. So they've already adjusted and agreed to, like, I'm assuming the royalties behind that and any like copywriting issues. So if you're looking for, an easy tool that is, or a great tool that is easy to learn and has the team collaboration function, meaning like everyone on your organization's team can see the same design, I would definitely go with that.
Right. Thank you. And then I don't know if you have any, but any last words of wisdom for anyone who might be like starting a COVID social media campaign or embarking into like trying to find a job during COVID? Any words of wisdom?
Yeah, so I guess that's kind of like two things, because social media is very, very difficult all in itself. So for social media purposes, for campaign purposes, I would just say, don't give up. Like, you have to keep going. You have to be consistent. If things stop working or you're not seeing the kind of engagement that you're hoping for, pivot, but don't stop, right? Because all of this content is still useful and can be repurposed later on. No one is going to remember a year from now that you posted something a year ago. So you can always bring things back, create it or tweak it in a new way. And then that's more content for you to use. I think it's important to also remember that it is a business tool. They call it social media in the terms of and the hope of being social, but it is at the end of the day a business tool and a way for people to gain exposure, but also collaborate with other organizations and other groups. I think that's the best way to kind of navigate that. And then as far as the job search, same thing, just don't get disheartened. And now that the world is kind of reopening, I would highly suggest trying to do networking events. I know this is virtual, and hopefully the in-person or hybrid blend will allow for in-person networking again. But even if that's not possible at this time, using LinkedIn and asking for a virtual coffee or tea date, informational interview, and just trying to figure out what do you want to do. The last 2 years of being in the communication space, it's huge. There's so many areas that you can go into for areas that you want to focus on, let alone types of jobs within communication. So figure out what you like doing, what you don't like doing as quick as possible, and just be open-minded to as much as you can. It's better to figure out very quickly what you don't like to do than to be stuck for years in a job that just doesn't serve you. And last piece of advice I would say is challenge yourself, right? To move on and leave jobs behind and try other things out from a financial perspective, because if you stick with the same company, chances are, the amount of money that you could be making, you might be missing out on opportunities for growth, to be challenged in a new role. Like, you want to keep learning and being challenged. And that also comes with a boost in paycheck. I've saw that somewhere, like people who stay in the same job for 5 years tend to lose out on like a 25% pay raise that they could have done just by simply leaving the role that they were at within a year to 2 years, like every 2 years, and having a bigger pay bump. So I took that advice. I was like, okay, time to move on.
Thank you so much, Cassie. That was so great. I forgot how much I love just like hearing you talk about social media.
Oh, yeah, I'm so happy to be here and to chatted through some of this. Like I said before, it's still like very, very much a work in progress, still learning every day, and it's always changing. So I hope some of this helps and or inspires someone to, think strategically about a campaign or apply for a job that maybe they didn't feel like they were the most qualified for, and just go for it.
Yeah. We will go ahead and close this session out. If attendees, if you have any questions for Cassie, feel free to email me at the email address I just posted in the chat box. And I will make a list of questions, send them off to Cassie, and have her answer them for you. I am trying to think if there's anything else. I don't think so. I will also just go ahead and close out the Youth Summit while we're here. I want to thank everyone again for joining us today. It went great. We had so many great presentations, and we had the chance to hear from the Surgeon General, which is always exciting. There will be an evaluation coming out after the summit, probably later tonight or early next week, that we do ask you to fill out. We love hearing your feedback. And then if you do have any extra feedback, things you'd like to see in the future, feel free to email me, same email address I posted in the chat box. I'd love to hear what you guys have to think. Thank you all again so much for coming, and have a great rest of your night.